Sarcoidosis. What's going on, Secoya Nation? This is your holistic clinician, Dr. Schilling. We're bringing you some wellness wisdom today. Talking about sarcoidosis. So if you don't know what sarcoidosis is, you're probably wondering, what does this mean? So these are like granulomatous, thick, inflammatory nodules that develop in the lungs and then in the mucosal membranes, all over the body, if you will. They come up in different parts of the body. And we're talking about the neuroemotional stresses related to that, so you can understand from your perspective or someone you know the brain-body connection and why they develop, okay? If you're not familiar with some of the symptoms of sarcoidosis, it can show up in like a persistent cough, bumps on the skin, it can be shortness of breath, you could have fatigue and weight loss. There's all kinds of things that show up. Red eyes, along with the eyes, the vision problems go along with sarcoidosis. You can have swollen lymph nodes. It can even have joint pains or even bone pain. So when we understand that sarcoidosis is like a self-devaluating conflict, think of what we mentioned a second ago. All those different symptoms are mostly connective tissue. Ligaments, tendons, bones, skin, mucosal membranes, and stuff like that. And from a German new medicine standpoint, self-devaluation is related to worthlessness, and connective tissue is a feeling of worthlessness, okay? When it comes to sarcoidosis specifically, we're talking about someone with self-devaluation conflicts, thinking less of themselves, okay? Oftentimes it's discussed that they hesitated to act. They feel less of themselves because they were sitting on the fence and they didn't decide whether to attack or defend themselves. They didn't know whether to, fight or flee, so they just froze, maybe fawned, if you will, if you understand the technical language there. They oftentimes feel less of themselves or less about themselves because of some type of, in German medicine literature, there's a lot of references to sexual experiences when it comes to sarcoidosis. So they might have suffered rape, incest, groping, sexual rejection when they were in the midst of intercourse, something like that. That all comes up as them, a person dealing with sarcoidosis is feeling less about themselves as a result of those things. Now, furthering on the self-evaluation conflicts, we're talking about people feeling a sense of impotence, like they don't have the power to either counterattack or to repel or defend an attacker, if you will, especially when it comes into another person's sexual advances, if you will. So typically men are the aggressors, but there are definitely situations where women are the aggressors as well. So there is some discussion of, I should not have attacked so fast or so ferociously, so intensely in order to defend myself or people I love or my friends. And that goes back into that self-evaluation conflict and that hesitancy, that waffling between I should have attacked, I shouldn't have attacked, should I have attacked that hard? I mean, it's all about the second guessing of self and that feeling of worthlessness and that second guessing of, I'm not good enough, things like that. There was some reference as far as some disgusting image that was seen. I think it was related to illness, which then correlated to fear of death or fear of the future in general. I think there was some mention of, an example of cancer of some sort, and it was talking about maybe a person saw an image of an X-ray or a CT scan or a tumor of some sort on the screen for the image, and then they couldn't get that out of their mind, so that then developed that fear of the future or that fear of death, if you will. So when you think of sarcoidosis, you think of if it were to show up on the skin on the lower leg, like feelings of flawed and shame because I can't keep up with the expectations. If it's the lungs, it's about fear of failure, fear of being exposed, fear in general, grief and worry, stuff like that. Eyes are like, I want to see or I don't want to see. I miss someone or I don't want to see them, things like that. And that comes back into that self-devaluation. Swollen lymph nodes. Lymph, if you recall from previous videos, and if you haven't checked it out, go and check out the lymph videos about inability to let go of ideas and concepts and situations and things that have happened to you, things of that nature. We talked about the connective tissue. So it just comes in a bunch of different flavors here. So if you found this beneficial, share it with someone you know who you have heard of dealing with sarcoidosis, or maybe you deal with sarcoidosis and you want someone to help, you want to help them understand you. Super beneficial to help them understand like what you're going through. You might not be real excited to share with them about a horrible past sexual experience, but if it's someone you care about and someone you trust, maybe you feel safe enough to do that. At any rate, it's important that you shine a light on things that cause you to feel shame and things like that, because once you shine a light on them and name them, they don't have any power over you anymore. So If you feel like this has been beneficial, share it with someone you know, and let us know how we can improve. Let us know what you want us to talk about, and we look forward to serving you in the next Wellness Wisdom video. All right, take care, guys.